Welcome back to Studious. In today's lesson, we're tackling two anatomical direction terms that trip up even advanced medical students: rostral and caudal. These are directional terms used to describe positions along the head-to-tail axis of the body, and they are absolutely essential vocabulary in neuroanatomy, embryology, and clinical medicine. You encounter these words constantly in textbooks, research papers, radiology reports, and neuroscience lectures. Yet many students rely on guesswork because nobody ever clearly explains the rules. In this video, we're going to fix that. We'll cover the definitions, the Latin roots, how these terms apply to the main body axis, how they shift inside the brain, and the important exceptions you must know. By the end of this lesson, you'll use these terms with complete confidence. Let's get into it.
Just like every other directional term in anatomy, rostral and caudal are always interpreted relative to the standard anatomical position. This is non-negotiable. It is the universal reference point that every medical professional on the planet uses to communicate about the body without confusion. In this position, the body stands upright, eyes looking straight forward, arms hanging at the sides with palms facing forward, and feet slightly apart pointing ahead. Here is the key principle. No matter what position a patient is actually in, whether they are lying face up, face down, or curled on their side, all anatomical directional terms still refer back to this standard standing position. Getting this baseline right is what separates precise clinical communication from vague, error-prone descriptions. Always start here.
Let's define these two terms clearly. Rostral comes from the Latin word rostrum, which means beak or nose. In anatomy, rostral means toward the head, or more specifically, toward the front or nose end of the body. Think of it as pointing upward and forward, in the direction of the face. Caudal, on the other hand, comes from the Latin cauda, meaning tail. So caudal means toward the tail, or in humans, toward the lower end of the body, the feet, and the base of the spine. A simple memory anchor. Rostral equals nose, caudal equals tail. Along the main axis of the body and spinal cord, rostral is essentially equivalent to superior, meaning higher up, while caudal is equivalent to inferior, meaning lower down. These are your default rules outside the brain.
Along the spinal cord, which is the most common context where you will encounter these terms outside of the brain, rostral and caudal have a beautifully consistent meaning. Rostral means toward the brain, toward the head end of the spinal cord. So if a lesion is described as being rostral to a certain spinal level, it is located above that level, closer to the brainstem. Caudal means toward the base of the spine, the sacral and coccygeal regions, pointing downward, toward where a tail would be in other mammals. For example, the cervical spinal cord is rostral to the thoracic spinal cord, and the lumbar cord is caudal to the thoracic cord. This consistent head-to-tail directionality makes rostral and caudal extremely useful terms when describing spinal cord injuries, tumor locations, or nerve root levels in clinical practice.
One of the most important contexts where you will encounter rostral and caudal is in embryology, the study of how the human body develops. During early embryonic development, the neural tube, which eventually becomes the brain and spinal cord, forms along a clear head-to-tail axis. The rostral end of the neural tube gives rise to the brain, including the forebrain, midbrain, and hindbrain. The caudal end develops into the spinal cord. Developmental abnormalities are routinely described using this terminology. For example, a neural tube defect at the rostral end may result in anencephaly, the absence of major brain structures, while a defect at the caudal end can lead to spina bifida. Understanding that rostral means head end and caudal means tail end in the embryo allows you to immediately map where any developmental condition originates. These terms are foundational in developmental neuroscience.
Here is where rostral and caudal become genuinely complex, and where most students get confused. Inside the brain, especially in the cerebrum, the standard head-to-tail axis does not map cleanly onto a simple up-down direction. This is because, during evolution, the human brain underwent a dramatic bending and folding process. The forebrain rotated and expanded forward and downward. As a result, within the cerebrum, rostral no longer simply means upward toward the skull. Instead, rostral in the cerebrum refers to the frontal direction, toward the front of the brain, toward the forehead, and caudal refers to the occipital direction, toward the back of the brain, toward the back of the skull. So in a neuroanatomy textbook, when you read that one structure is rostral to another inside the brain, it means it is more toward the frontal lobe, not necessarily higher up.
The brainstem occupies a transitional zone between the spinal cord and the cerebrum, and the use of rostral and caudal here reflects that transition. In the brainstem, which includes the medulla oblongata, the pons, and the midbrain, rostral means toward the midbrain and the higher brain above it, while caudal means toward the medulla and the spinal cord below. Clinically, this matters enormously. For example, a rostral brainstem lesion affecting the midbrain can produce very different neurological deficits than a caudal brainstem lesion in the medulla, which might affect breathing, heart rate, and swallowing. Knowing that rostral equals upward toward the brain and caudal equals downward toward the cord allows you to immediately localize which cranial nerve nuclei, tracts, and reflexes are likely to be affected when reading a neurology case.
A question that comes up constantly: when should you use rostral and caudal versus simply saying superior and inferior? The answer comes down to context and precision. In general body anatomy, the trunk, limbs, and neck, superior and inferior are the preferred standard terms. Rostral and caudal are specifically favored in neuroscience and neuroanatomy contexts because they carry the nuance of the neural axis orientation, which, as we've seen, rotates inside the brain. Using rostral instead of superior in a neuroanatomy description signals that you are referencing the neural axis, not just a simple up-down position. In research literature and neuroscience journals, rostral and caudal are the dominant terms precisely because they communicate directionality relative to the brain's own coordinate system. As a med student, knowing when to switch between these vocabularies marks you as someone who truly understands anatomical language.
Let's close with a clean summary of everything covered today. Rostral means toward the nose or head, derived from the Latin for beak. Along the spinal cord, it means toward the brain. In the cerebrum, it means toward the frontal lobe. In the brainstem, it means toward the midbrain. Caudal means toward the tail or lower end, derived from the Latin for tail. Along the spinal cord, it means away from the brain toward the sacrum. In the cerebrum, it means toward the occipital lobe, the back of the brain. In the brainstem, it means toward the medulla and spinal cord. And in embryology, rostral and caudal define the head end and tail end of the developing neural tube, respectively. Master these mappings and you'll navigate neuroanatomy, spinal cord lesion localization, and developmental anatomy with total clarity. Thank you for watching Studious. Like, subscribe, and share for more.